I'm doing my informative speech. This is my audience, my brother and my dad. And my name is Nee. My informative speech is going to be on my job. And my job in OBGYN patients, you need to learn how to show empathy and sympathy, and you need to put yourself in their own shoes and what they're experiencing. And then we deal with patients that are obese, and they're pretty much easy, but sometimes they do have a lot of concerns that we have to take care of. So let me go ahead and start. I'm a medical assistant at OBGYN. We do have 7 doctors. Two of them are nurse practitioners, but we consider them as doctors because they are always there helping. But the only thing is they do low risk obstetrics, and mostly they do gynecology work. So basically, as a medical assistant, I take vitals, I ask patients what their problems are, making sure that they are doing fine and that there is nothing wrong with them. Sometimes when they have problems, I try to gather as much information as I can, so when the doctors go and see the patients, they don't come in there bombarded with questions and not knowing what to do. So basically what I do is get answers and problems, what's going on, and try to help patients understand that this issue could be resolved, but it has to be taken care of by a doctor. So as a medical assistant, I need to learn how to talk to patients. I need to understand how to deliver my questions and my answers. I always have to think about before I speak. If I don't think about what I speak and something just comes out, patients will most likely take it as a wrong way. So basically, as a medical assistant, it is our duty to make sure our doctors are very organized and make sure that we are always a step ahead of them. Being a step ahead of them means that we know what the patient needs. We know how many weeks the pregnant patients are. We know why this patient is in the problem visit or why this patient is doing this. You can't just expect a doctor to know everything and give you answers. No, but you need to learn those things yourself so you can be the doctor's right hand or left hand. So you can help them with all procedures and everything. And then being a medical assistant, it's very educational and very fun. Working in a doctor's office, they're very informative and they are willing to teach you. With that being said, I always have like a very special relationship with my doctors. I always communicate with them. I communicate with them. I try to communicate with patients, and we have patients that come in with white coat syndrome. So basically, their blood pressure are through the roof, and when their blood pressure is through the roof, we try to make sure that they're calm and steady before being seen by the doctor. We always ensure them that it's going to be a fine visit. You're just here as a yearly routine just to make sure everything's fine, this and that. Or sometimes when they have problems, like they have to go to minor surgeries or they have to get something checked out because they're scared something might have happened to them. We all try to ensure that they are fine and ensure that that they are in good hands, and just reassure them that everything's going to be fine and that they need questions or need someone by their side when the doctors are coming in, that we are there for them. And then birth controls. Everyone thinks that birth control are prevention to not have kids. Truth is, birth control can do a lot of things for females. Some females have menorrhagia, which is very heavy bleeding with cramping. So with birth control, it helps lessen the flow of the period. And with that, it helps PCOS. It helps young girls with very bad cramps. It just helps a lot of things. Birth controls we have are like the IUDs. We have like sterilization, which are permanent, but those are for different people. Like we have the pills, we have the patch, we have the ring, we have the shot, and we have like so much more, like the diaphragm and spermicide. But once again, birth control pills aren't just for preventing from having kids. That's one of the things, but it does a lot for a woman's body. For example, it helps lessen the periods, it helps with the cramps, it helps them get on cycle, like having them come every month, making sure the flow is less. Or sometimes some females do not like periods at all because when they have it, they bleed crazy or they are in a lot of pain. So birth control are the main functions why we're open, and this is why the OBGYN everyone comes in for, or basically birth control or problem visits. And once again, this is a OB chart, which is basically when they get pregnant. We make sure when we schedule their appointments, they're at like the correct week and when they should come and visit on their schedule. So once again, thank you again for listening to this, and I hope you guys like this.